Hi everybody, my name is Jessica Mason and this is my oral report on Claire Dunphy in regards to the application of behavioral therapy. A little bit of background on Claire Melinda Dunphy. She is a 44-year-old Caucasian female. She has 3 kids, Haley, Alex, and Luke, and she is married to her husband for 22 years. She has a very close relationship with her father. Not so much with her mother. She's very distant from her. She always saw her mother as being very critical of her. And she's the oldest actually of 4 siblings. She has a full sibling, which is Mitchell, her brother, a half sibling, which is Fulgencio or Joe, and she has a step sibling who is Manny. She has a pretty good relationship with all of them, and she is also, or was, a stay-at-home mom for about 20 years, at which point she has now taken over her father's closet business. She is determined to always be on the correct side of an argument. She does not like being wrong. She does not handle it well at all. She's also extremely competitive, and that is with her friends and her family, even strangers. She's a very competitive person. Also, she has recently been able to admit that she drinks a lot for the better half of the last decade. Sometimes she would hide it, sometimes she wouldn't. Sometimes it would be mixed with something else. Other times it was, just a glass of wine and that was it. However, she does tend to drink whenever anxiety is high. So, keeping Claire in mind, we are now going to be exploring behavior therapy. Some things about behavior therapy is that it is scientifically based. It focuses mainly on what is going on at the present time rather than past events. It is a very active approach to therapy, but it does kind of deal also with what can be observed externally and how things are internally processed. At least the more modern behavior therapy does do that. Behavior therapists tend to believe that changes in behavior can occur, which promotes a better understanding of the self internally. Treatment and assessment is an ongoing process, and treatment is customized. It is not one size fits all. A lot of behavior therapists actually, understand that if you don't have treatment that is customized to the person and the issues that the person is dealing with, it can fail. It can fail miserably. So, going into a little bit of the history of behavior therapy, we are going to be looking at some of the forefathers. We have Skinner, who conceptualized operant conditioning. Most of his contributions were actually made from the laboratory. Everybody kind of is already aware, I'm sure, with the Skinner box. And Skinner believed that psychology and therapy should not focus fully on what's going on internal, but also the behaviors that it causes. Then we have Albert Bandura. He conceptualized the social cognitive theory. He was the one who had done the experiments with the kids beating the Bobo doll. He believed that individuals learn how to function based off what they've learned through observation, through social modeling, and kind of had that triangle of human motivation, thought, and action. He also posited that, people need a sense of self-efficacy in order to create a successful life for themselves and to meet inevitable obstacles and adversaries they encounter, according to Corey. Now we have Arnold Lazarus. He conceptualized the multimodal theory and the basic ID assessment. You'll see a little more about that as we go into Claire's specific case. He founded clinical behavior therapy, and one of the things that's really interesting about Lazarus is that while in the beginning of the class we kind of had touched base on the ethics of dual and multiple relationships, Lazarus actually believed that it is possible for therapists to have dual and multiple relationships with a client in which they'll actually benefit from it that doesn't necessarily pose harm to either side of therapy. Now, obviously, that doesn't apply to everybody. you would definitely have to keep safety in mind in regards to that. He's actually posted a lot of articles and a few books also in regards kind of touching on that basis. So we have the 4 areas of development. We have classical conditioning, which I'm sure we all remember from Psych 101 days. The APA defines classical conditioning as a type of learning in which a behavior comes to be elicited by a stimulus that has acquired its power through the association with biologically significant stimulus. So basically, we all remember Pavlov's days. You have the dog, you give the dog food, the dog salivates. Then all of a sudden you ring the bell. You do that so many times, giving the dog food each time, you'll have the dog still salivating. Well, then when you remove the unconditioned stimulus, all of a sudden you will have the bell ringing as the neutral stimulus, which elicits the conditional response, which is the dog salivating over again. Now we have the 4 areas of development with operant conditioning. Basically, you have where what you learned is either from negative or positive reinforcement or negative or positive punishment. That is very much applied to children. As a mom, I can definitely say, you have a son, or I have a son. I don't know if you have a son. If he's doing something wrong, say all of a sudden he throws toys all over the floor, it just makes a complete mess. You add something unpleasant, like say all of a sudden I will just yell at him saying, "Do not do that." You are introducing a tone and words in a manner that they do not like hearing. Now, obviously, that's not necessarily a very high, or a very high grade, positive punishment, but, sometimes it does work. So then we have social learning. The social learning stresses a role of observation on the imitation and behaviors observed by others. With the Bobo doll experience, basically, the kids were introduced into the situation where they would see the Bobo doll, they would hit the doll based off what they observed other kids doing or seen. We have cognitive behavior therapy, which will be touched on a little more, but basically it's just kind of the circle of behavior, emotion, thought, and how you can change the way a client thinks about or perceives a significant life experience. We have operant conditioning as some of the therapies and techniques in therapy. We have operant conditioning, muscle relaxation, systematic desensitization in vivo and flooding. We have eye movement, desensitization and reprocessing, social skills and associative training, self-management programs, multimodal therapy, mindfulness and acceptance-based cognitive therapy, which is mindfulness, stress relief, basically, mindful-based cognitive therapy, and then you also have, more acceptance-based cognitive therapy. All of these are actually very interesting. For instance, multimodal therapy, which is what we'll touch base on right now, is a systematic and holistic approach requiring the therapist be eclectic in custom-building treatment to the client. Some strengths and limitations. As far as behavior therapy, it really can be measured and observed, and you can see the progress that your clients are making. Some of the limitations that you have, though, is that, while it's changing them in the then and now, and you can observe how it is outside or externally, you really can't see what's going on internally or how they're processing. It really just depends on how active they are in their therapy to see the difference. So with Claire, we are going to go ahead and we're going to apply the multimodal basic ID. Her behavior, she's under eating, she's quick to jump to conclusions, she's very quick to react in situations, she has poor sleep quality, she requires constant organization in her household and in her life, and she kind of does have that frequent alcohol consumption and a very competitive nature. The effect is A of the basic ID. She stresses the criticism and failure. She's she does show occasional resentment to the way she was brought up, her relationship with her mother, and she kind of has an inferiority issue. She does not like to be seen as inferior whatsoever. She wants to be seen as the strong, noble person. Sensation. She actually does have a heart condition, so she has tachycardia, which kind of flares up in stressful situations. Exhaustion, fatigue, imagery, poor physical self-image. She has a lot of criticism from her mother that she kind of hears herself internally, and she is afraid of failing her father. Cognition, concerns about running her father's business, worries about failing her family and the business. Interpersonal relationships, she feels the weight of her family's dependence on her and how they'll always come around to her. They go to her dad, but they also come to her in regards to what she's doing with her children, at least Mitchell and Cam do. She does have problems with deviance from her children, and she's very competitive with her friends and family. Drugs and biology, she does have a heart condition. She does take vitamin supplements, but no prescribed drugs. She does have poor eating habits as of late, and she does like to run and practice yoga. So the goals for Claire is just basically for her to be happier about herself in life, have a more positive self-image and body image, learn how to cope with anxiety, build and maintain a positive relationship with her friends and family. Those are the more general goals. There are a few more that are specific. The therapeutic relationship will definitely have Claire being active and collaborative with a therapist, and flexible with her therapy. If they see that something's not working, they'll have to change it. Being genuine and being constructive towards working towards that goal. Mentioning about being flexible, the therapist will have to remain eclectic through the therapy in order to make sure that therapy is custom to Claire. So for this, we're going to look on mindful-based cognitive therapy. I kind of felt like this would fit her best on the behavioral side, even though it is kind of more cognitive. So she'll be participating in an 8-week weekly meeting group where they'll be lasting about an hour to 2.5 hours per session, just depending. In week 1, Claire will learn how to identify maladaptive thoughts she experiences when a stressful situation occurs and how to handle them using mindfulness practices. Week 2, Claire will observe reactions she has to stressful thoughts and situations. Week 3, she'll learn how to focus her breathing and how to guide her attention when she is stressed. Week 4, she will learn how to experience the now without being over concerned about the future. And in week 5, she'll learn how to experience the now without holding on or dwelling on it too much when it's in the past. On week 6, she'll understand how to accept thoughts she has without feeling the need to act on them. And during week 7, she'll learn ways that she can prepare and prevent possible relapse. Week 8, she'll realize how and when she can naturally implement being mindful outside of therapy, while still also kind of touching base on preventing relapse. So that's it. Thank you so much. I hope you enjoyed this video, and good luck, everybody.